Let's look a little bit closer at the pleasure-pain balance, because therein lies the tools for you to be able to control motivation toward healthy things and avoid motivated behaviors towards things that are destructive for you. There are a lot of reasons why people try novel behaviors, whether or not those are drugs or whether or not those are adventure, thrill-seeking things, or, they take a new class. As you'll notice, I'm not placing any judgment or value on these different behaviors, although I think it's fair to point out that for most people, addictive drugs like cocaine and amphetamine are very destructive. Actually, we know that about 15 to 20% of people have a genetic bias towards addiction that, you sometimes hear that the first time that you use a drug, you can become addicted to it. That's actually not been shown to be true for most things and most people, but for some people that actually is true. But in any case, the way that addiction works and the way that motivation works generally in the non-addictive setting is that when you anticipate something, a little bit of dopamine is released. And then when you reach that thing, you engage in that thing, the amount of dopamine goes up even further. But as you repeatedly pursue a behavior and you repeatedly engage with a particular thing, let's say you love running or you love chocolate. As you eat a piece of chocolate, believe it or not, it tastes good. And then there's a shift away from activation of dopamine, and there are other chemicals that are released that trigger a low-level sense of pain. Now, you might not feel it as physical pain, but the craving that you feel is both one part dopamine and one part the mirror image of dopamine, which is the pain or the craving for yet another piece of chocolate. And this is a very important and subtle feature of the dopamine system that's not often discussed. People always talk about just as pleasure. You love social media, so it gives you dopamine, and so you engage in that. You like chocolate, it releases dopamine, so you do that. But for every bit of dopamine that's released, there's another circuit in the brain that creates, you can think of it as kind of like a downward deflection in pleasure. So you engage in something you really want, and there's an increase in pleasure. And then there's without you doing anything, there's a mirror image of that, which is a downward deflection in pleasure, which we're calling pain. So for every bit of pleasure, there is a mirror image experience of pain, and they overlap in time very closely.